Welcome to CareConnections Quick Tips. Once you've added a patient to the CareConnections system and queued them for an assessment, you'll want to queue them up on a tablet in the office to take the assessment. So let's take a look at how to do that. The first thing you'll want to do is bookmark on your tablet in your office the website kiosk.careconnections.com. This way you can navigate directly to this page where they'll log in. So once you have that ready and prepared, then you'll want to queue up the specific patient that's coming in. So we'll queue up our 1, 2, 3, 4 patient. To log them into the kiosk to take their assessment, you'll want to come over here to the patient assessment queue. The patient assessment queue is where you'll find this 4-letter unique code. It's this and their date of birth that will connect the right assessment with the right patient in your system. So we'll make a note of this patient login and the patient's date of birth, and we'll enter them either on the tablet or the computer workstation. So we have the code and now the date of birth. And we have the choice to select between English and Spanish. Then we log them in. You can either have the patient choose the body region or you can choose the body region for them. If they're coming to you for something very specific, we generally recommend that you choose the body area for them. Something to note about an evaluation. Sometimes a patient comes in thinking they have a hip or a leg problem, but it's really in the lumbar spine. Conversely, sometimes they think they have a shoulder problem, but really there's cervical involvement. So anytime a patient selects the lower extremity, the hip, leg, knee, ankle, foot, for the evaluation, it will also give them the lower back questions, just in case it's actually a lower back issue. You'll see later how to enter a diagnosis into the patient record, and we'll let the practitioner make the determination whether it's lower extremity or lumbar spine. And then the same thing for the upper extremities and then the neck and middle back or cervical thoracic region. So it'll give them both sets of questions to make sure they're all captured so you don't have to re-administer an evaluation if the patient hasn't identified the true body part that's being worked on. So for our example, we'll pick a lower extremity and we'll click Next. Then it will give us some instructions for what to expect on the coming questions, and we'll go through these questions quite quickly. Feel free to queue yourself up as a dummy patient and go through them more slowly if you want to take a look at what the patient is reading and what the questions look like for them. First, we'll start with a couple of general functional questions, and then it will move into more body region specific questions. One tip that a clinic has given me with your older patients who are maybe not quite as comfortable with technology is oftentimes if you hand them a stylus, it reminds them of pen and paper or a pencil, and they get a little more comfortable and might fight you a little bit less on using the technology. So that's a nice tip that I pass on as frequently as possible. So here you can see we're getting into more region-specific questions about things you might be doing with your lower body or lumbar spine, the standing, the sitting, etc. And then it takes us to our acuity. If any of you have been using paper in the past, you know that the patients like to skip this one. So this takes them right to the question, make sure they answer it. And here's our pain index. And we click Next. And here you see the thank you for completing it and survey gets clicked. And it takes us back to the login page. At this point, the patient can hand the tablet back to you, and you can log in the next patient. If we go back to our CareConnections account and hit refresh, we'll see that our patient is no longer in the patient assessment queue because they've taken their assessment. And when we head over to treatment registrations, you'll see that the checkbox in the queued assessment column has disappeared because, again, they've taken that assessment. And that's it. Remember, if you ever have any questions, you can always email us at support@careconnections.com.